Hello and welcome to the EULAR TV in beautiful Barcelona. We are at the EULAR Congress 2025. I'm Maria Sokolova. I'm a medical doctor and researcher at the University Hospital Schleswig-Holstein in Kiel, Germany. And it is my great pleasure today to welcome to this interview Dr. Michael Hughes. He's a consultant rheumatologist at Salford Royal Hospital and clinical senior lecturer at the University of Manchester, UK. Dr. Hughes, thank you very much for being here with us.
Thank you very much for the opportunity to join the conversation, and It's a beautiful day outside.
Yeah. So I would like to ask you a few questions. You are a co-leader of the World Scleroderma Foundation ad hoc committee, and I wanted to ask you about the current goals of the committee for the future and your current concepts on that.
Thank you very much for the question. So I co-lead the World Scleroderma Foundation GI Ad Hoc Committee. I co-lead this with Dr. Susanna McMahon, and this is an international group of experts, not just rheumatologists, but GI specialists, so gastroenterologists and GI surgeons, other important stakeholder groups themselves, like patients who've got a very strong voice. And broadly speaking, we're trying to find new ways to measure and understand the pathophysiology of GI disease in systemic sclerosis, but also think about improving treatment strategies. Because broadly thinking, around 90% of patients with systemic sclerosis have GI involvement. It's often one of the earliest features of the disease, and it can affect the entire of the GI structures from the esophagus through to the more lower parts of the bowel. And we know from our work, including a large multinational survey, that GI symptoms are hugely burdensome, yet we have very little tools to treat them.
Yeah. Thank you. That's very insightful. And also, your talk today was during the session Systemic Sclerosis Managing Difficult Cases of Common Manifestations, with the focus on these gastrointestinal manifestations. And I feel like gastroesophageal reflux is very or often neglected manifestation of systemic sclerosis, and I was wondering what is your take on whether we should involve gastroenterologists more, or who should be primarily responsible for the management of this manifestation.
So today I presented our World Scleroderma Foundation refractory gastroesophageal reflux disease, or GERD, guidelines, and that was a multidisciplinary steering board or task force. So 36 recommendations in 5 groups of recommendations how to approach in real world clinical practice refractory GERD. Going back to the original question, I think that GI symptoms are hugely burdensome. They're often there early in the course of the disease, but I think that we need to work closely with the experts, with gastroenterologists, sometimes with GI surgeons, but also with allied healthcare professionals like nutritionists and dietitians. They can play a really important role. So at Salford, where we look after around 600 patients with a confirmed diagnosis of systemic sclerosis, we have very close links with our gastroenterologists, and we work closely throughout the course of their disease.
Yeah, I think collaboration is key, like in a lot of things, in not only in rheumatology, but in a lot of disciplines. And I also prepared the last question for you. We would like to know, in your expert opinion, what do you think is the biggest unmet need right now in the management of systemic sclerosis?
So I think that over the last 10, 20 years, there's been huge advancements in the contemporary management of systemic sclerosis, and I think we're in a very good position. And I think that's reflected by the number of clinical trials over the past few years. But my personal take on things is twofold. One is the early diagnosis of systemic sclerosis, and I think there's a key role for patient organisations. So we work closely with SRUK, Scleroderma and Raynaud's UK, also with FESCA. And I think that they have a really important role in raising the awareness of Raynaud's phenomenon, which affects about 5% of the general population and is often the earliest symptom in patients with systemic sclerosis. I think there's in part a need to increase awareness of primary care physicians and general practitioners who might receive very little training during their medical school and postgraduate training. But I think also in terms of early diagnosis, I think access and use of now-fold capillaroscopy, looking at the microcirculation, is a key diagnostic test, and it's not routinely available. I think the second thing that really needs further attention is the later stage of the disease. So clinical trials and research is really focused on the first 5 years, so patients with
Yeah.
early, particularly diffuse systemic sclerosis. And I think that patients are living longer, they're living with more comorbidities, and therefore I think that we need to start to think more about this neglected group of patients. So certainly as in one of my roles as a EULAR counsellor, one of my clinical projects which was approved was looking at late skin fibrosis in systemic sclerosis. We had 3 conceptual models of late skin disease, and we showed that in the EUSTAR analysis, about 20% of patients had late skin involvement. So I think early diagnosis and the later survivors of the disease are 2 of the big things for the future.
Yeah. Thank you very much for doing this important work. It's been a great pleasure talking to you. Thank you very much for finding time during this Congress. And please stay tuned to our EULAR TV content.